Some people have medical conditions that hurt their ability to get the sleep they need. These patients experience what are called sleep disorders or somnopathies. In this video, we will learn about 3 common sleep disorders: obstructive sleep apnea, snoring, and insomnia. Sleep apnea is one of the more common sleep disorders. Scientists are researching sleep apnea more and more as they realize its harmful effects. Whether or not you know someone with sleep apnea, you're probably aware of its more mild version, which is known as snoring. When you listen to a normal sleeper, you probably notice that they're breathing, but it's not particularly loud. If you have a friend or a family member that snores, you know how loud and irritating snoring can be. But what exactly is happening when you're snoring? Take a look at the picture of the airway of the sleeper on the left. The tongue and other throat muscles relax, but not too much, so there's a steady flow of air through the airway as it gets to the lungs. Look at the picture on the right. You'll see that the tissues have relaxed a little bit, so the airway is partially blocked up. Who do you think is going to snore? If you guessed the sleeper on the right, you're correct. That characteristic snoring sound that might keep you awake at a sleepover or a camping trip is simply the sound of over-relaxed tissues that are vibrating as air forces its way through. Snoring happens when the muscles that control the tongue and the soft palate, or the part of the roof of your mouth without a bone, relax and block the airway up a little bit. So sleep apnea is, in a sense, a type of extreme snoring. But what if you don't sleep normally and you're having breathing problems that are a bit more serious than snoring? Then it's most likely sleep apnea, again, which is the more extreme variant of snoring. So remember, we looked at the 2 diagrams earlier of the normal patient and the snoring patient. Remember, when you breathe normally, the air can go down your airway really easily. If you snore, you don't get as much air because it's partially blocked up. So that's why if you can listen to your family members or your friends snoring, bottom right, the airway is completely closed by relaxed tissue instead of partially closed. So these tissues are relaxed too much. If you have sleep apnea, you actually stop breathing until your brain realizes that you need to get more oxygen. When this happens, you have to wake up briefly to regain control of your over-relaxed muscles. People affected by sleep apnea face this problem throughout the night, sometimes hundreds of times every night, and they may or may not know it. How would you like it if someone woke you up constantly during the night while you tried to sleep? Probably not that much. I know I wouldn't either. And that is what it feels like to be woken up constantly by sleep apnea, which stops you from breathing in the middle of the night. Sleep apnea has various symptoms that are usually seen with it. Remember that sleep apnea happens when a person's breathing repeatedly pauses or stops and restarts throughout the night. Major symptoms include waking up frequently, very loud snoring, and being tired during the day. Remember, because you're being woken up continuously during the night, so you're not getting the quality sleep that you should be. Sometimes, a friend or a family member, such as a spouse, will notice that the person has stopped breathing in their sleep before the person themselves recognizes it. So why do sleep apnea and snoring happen? So the causes can vary. One known cause is from obesity, which results in the accumulation of fat in the tissues of the throat. This constricts the throat slightly, which makes it harder for air to get through. When these tissues relax, they block the throat up even more, which increases the likelihood that snoring will turn into sleep apnea. The more clogged up your area is with tissue, the more likely you are to have snoring or sleep apnea. Overweight and obese men are at the highest risk, but women can develop sleep apnea as well. So avoiding sleep apnea later in life, or now, is another really good reason to eat right. You don't want this to happen to you. Large tonsils can also be a cause of sleep apnea. They can also construct the airway just like any other swollen tissue. That's one reason why you may have had your tonsils taken out if they once became swollen. Sleep apnea can also be related to our brain's breathing control center not working properly. Even though untreated sleep apnea is very uncomfortable and sometimes dangerous, it can be treated rather easily. The most common method of treatment is for the patient to wear a mask called CPAP, which stands for Continuous Positive Airway Pressure during sleep. The CPAP mask gently forces the patient's airway open by blowing air into it, so the patient can breathe normally and get a normal quality sleep. Some other options include a nighttime mouth guard, which helps reposition the jaw to allow for a more natural airflow, or in very extreme cases, surgery can be used to remove some of the extra tissue or make the airway wider. For those who are obese, losing weight can also help. Insomnia is the general term that describes people who have a hard time falling asleep or staying asleep. There are a variety of factors that can cause insomnia, usually stress, depression, anxiety, ADHD, caffeine and medications, or genetics, as in insomnia can sometimes run in families. Insomnia can be temporary, which is rather common, so some solutions would involve practicing better sleep hygiene, like we talked about earlier, which is just better sleep habits, like picking a regular bedtime, avoiding caffeine before bed, and other tricks like this. Insomnia can also be chronic, So to wrap up, remember that getting a good night of sleep, which is about 8 to 10 hours a day for teens, is essential to our health, like eating, drinking, and exercising. Sleep helps us repair our minds and bodies, and our sleep schedule is regulated by a biological clock or circadian rhythm. Our sleep has 4 stages: N1, N2, N3, and REM. And if we accumulate sleep debt, which is what we get when we go for too many nights while getting too few hours of sleep, hurts our performance in and outside of the classroom. We just talked about sleep disorders, specifically sleep apnea, snoring, and insomnia, which hurt our ability to get the quality sleep that we need. And most importantly, remember to practice good sleep habits for a healthier you. Thanks for watching.